All right, welcome back to the Dental Domination Podcast. This is, believe it or not, episode 8. I'm so glad to be here and to be joined today by a very special guest, Mark Johnson. He is the founder of Student Loans RX. He's also a wealth advisor for RBF Wealth Advisors based in St. Louis. He's been doing this for roughly 30 years. So this guy knows what he's talking about. Watch out. And I hope you all pay attention for the next 30 minutes or so. Mark's going to be sharing some tips and tricks related to something that I know most dentists, if not all, can relate to and are interested in, certainly. And that's student debt and student loan debt specifically. The cost of dental school, as we all know now, my husband, who's a practicing dentist, certainly knows it as well. The cost of attending dental school now is astronomical. And I want to talk with you, Mark, today about some of that debt burden and what students fresh out of school and even, decades in some cases out of school can do to address that debt burden and how they can balance, living their lives with this crazy amount of debt that dental school unfortunately often comes with nowadays. But before we do that, I want to give you a chance to kind of introduce yourself to our listeners and kind of tell folks where you're coming from and what you're up to. So what can you tell us, Mark, about yourself, about Student Loans RX, and what kind of you're up to these days?
Okay. Hey, thanks a lot for having me on, Dan. So I've been in the investment industry for over 30 years, and 10 years ago, I got invited to speak to a group of orthodontic residents here in St. Louis. We have a very large dental residency program here, four disciplines or specialties here at St. Louis University. And so I went in and I think I bought some pizza and had about 40, 50 residents in their presentation room and talked about what I would call a financial planning 101 presentation. Yeah. The importance about budgeting, insurance planning, investment planning. I didn't mention the word student loans one time. This is 10 years ago. We get zero training in our industry on student loan repayment planning. Okay, it's very sad. One of the largest financial planning issues of this time.
Yeah.
And financial advisors get zero training on the topic. But in any event, 10 years ago, went in and did this presentation. A number of residents afterwards wanted to visit with me about things like disability insurance, starting a Roth IRA. And then they dropped the big bomb on me that they were graduating with between $400,000 and $750,000 of student loan debt.
It's now, wild. Again, in my opinion, it's criminal.
That's another podcast we could do.
So, we could.
Who's responsible and what we should do.
Well, the interest rates too are insane.
Yeah, lots of craziness. Yeah, the system was definitely set up for failure. But in any event, so I was curious. You're coming out of school with all our residency, with all this student loan debt. What resources are available to help you figure out how to pay this off? And does the school provide those resources? Has anybody come in and talked to you about this? And they said, no, we're kind of left up to our own. And I said, well, that's crazy. Let me see if I can find somebody that knows anything about this topic and bring them in for maybe another lunch and learn. And so I poked around in St. Louis. I looked either farther. I couldn't find anyone, again, 10 years ago, that knew anything about student loan repayment planning. So that was the genesis of Student Loans RX.
Wow.
And so for the past 10 years, we've been working with mostly dental professionals, but also some other healthcare professionals that come out of school with a lot of student loan debt.
Yeah.
And we incorporate that into an overall financial plan. Yeah. So my average client has about $400,000 in student loan debt. And so if you've got $400,000 in student loan debt, that's going to be, for many of the younger dentists, their largest item on their balance sheet, right? $400,000 of debt. And so our view is the best way to approach that is in the context of an overall financial plan. So we help them with budgeting, figuring out what they can afford to do for student loan payment, and then also where's your career path. Okay, are you on track to being an owner? Are you going into public health? And so all of those things, in our view, really informs the advice that we give clients on kind of how to tackle that large student loan debt.
Yeah, absolutely. Well, I love it. I love the service you're providing. It's so needed. And I'm not surprised, quite frankly, that 10 years ago you couldn't find someone else to speak to the topic. It's something that I think is absolutely neglected in dental school itself. But I think, within my circle, I know many dentists who have simply not been able to find resources out of school to help them tackle this really pressing burden. So I applaud you and your mission and what you're doing over at Student Loans RX. And I definitely want to share your information and contact information with our audience afterwards, and folks will be able to find that in the show notes. So thank you so much for joining today, Mark. I'm excited to have you here. Let's just kind of kick things off, though. I want to ask you, let's say I'm a new dentist. I'm fresh out of school. I have maybe, like you said, your average value of student loan debt. I have maybe 400 grand, 500 grand in debt. It's crazy. But what is the first thing that you would recommend a student do? And let's set aside for a moment contact Student Loans RX, because they could all benefit from that, I'm sure. But what is the first thing that you would recommend a new dentist do when they set out to tackle their student loan debt?
Sure. So assuming that the bulk of their loans are in the federal program, okay, one of the things that I encourage people to do, and we visited in some form or fashion last year over 50% of the dental schools through either webinars or different things. But I always encourage them, as they're a third-year dentist, third-year student, fourth-year student, file a tax return, even if there's a big zero on the bottom, especially if there's a zero on the bottom, because most graduates are going to get enrolled in what's called an income-driven repayment plan when they first leave school. Okay, and if they're on an income-driven repayment plan, as the name implies, the payment is based on your income. And so what happens is when we go to enroll folks in an income-driven repayment plan, you go into their studentaid.gov account, and as you're going through the electronic application, it goes out and it pulls in their most recent tax return.
Interesting.
Okay, so if you've got a tax return out there that's got a zero on it, guess what your payment's going to be for the first 12 months? Zero.
That'd be nice.
And then then they can use that first year of cash flow to do things like get their disability insurance, their life insurance, fund their Roth IRA, get relocated. Maybe they take a CE class or two or something like that, instead of having to make that payment that first year out of school. Now, if you're married and your spouse has some income, you might have to make a payment, or if you're on your way to residency. But we encourage folks, file that tax return the last 2 years of dental school to make sure you do that. And then also get enrolled in a plan immediately upon graduation. Now, a lot of folks say, well, I've got this 6-month grace period. I don't have to make any payments, but interest started accruing again on loans September 1st.
Yeah.
So if you've got $400,000 of student loan debt, and you kick the can down the road for your 6-month grace period, that's another $12,000 of interest that's been added to your loans, in my view, unnecessarily.
Right.
And so procrastination generally doesn't pay off, right? And so we encourage folks, have a plan ready to go. And we start working with our clients usually February, March before they graduate, because by that time, they've narrowed down a couple of potential opportunities for employment. Many of our clients have already signed an employment agreement by April 1st.
Yeah.
Okay. And so we kind of can help them go through their employment agreement. That's another topic. But the idea is that once you know, or you have a general sense of what your path is after graduation, that's the time to start putting a rough draft together in terms of a plan.
Now, you mentioned, once you kind of know what your path is, so that can be a huge determining factor in terms of what the outlook looks like in terms of paying off your student debt. So can you talk a little bit about the various pathways available to new dentists, not necessarily young dentists, but just new dentists in general, whether or not they choose public health, and there's some loan repayment programs out there for that. Whether or not they choose to open their own practice, or maybe they go into the DSO world, or whatever it may be. Can you talk a little bit about how that choice is going to impact them down the road when it comes to the prospect of paying off their debt?
Sure. So there's, typically I think 3 or 4 paths right out of dental school. So number one, maybe 20% go on to residency of some form or fashion.
Sure.
The rest become associates, either in a DSO or a private practice. Now, There might be 1% that buy a practice immediately on graduation, but it's very low number that, immediately after, but after 12 to 18 months, that number starts climbing towards practice ownership,
Yeah.
right? So for example, like I'm a small business owner, you're a small business owner. I love working with folks that are on track to being practice owners. And so, and I think practice ownership is the best student loan repayment strategy because you're going to make more money, obviously.
Yeah.
But that first 12 to 18 months out of school, most lenders want to see 5 to 10% liquidity in order to, give a young dentist or give a dentist a loan to buy a practice. So in that first 12 to 18 months, we generally are going to keep the student loan payment as low as possible so we can build up liquidity.
The liquidity, right.
And walk into wherever your lender is and get that loan for that practice. So that's one path that we work with a lot. I think 60% of, fourth year dentists say they want to be owners one day. So that's over half. So that's a strategy. Folks that are going into public health, there's a public service loan forgiveness program. That's 10 years of service in public health. You have to make 120 qualifying payments. You have to submit a form once a year from your employer, and that's a path. There's also a number of other repayment programs. So a lot of the states, if you go into rural communities or maybe underserved communities, you can get a couple of years of scholarship that goes directly towards student loans. I know there's a program called Students to Service, which is a 3-year program that provides $120,000 of student loan repayment. Great. But some of the DSOs now are even getting on board. I know I had a client that went and worked
as a benefit.
At a DSO, and she went into a rural area where they were having some challenges hiring, providers. And they gave her, I believe it was $15,000 a year for the first 3 years.
That's great.
Towards student loan repayment. So those are all things that a young dentist should be asking for as they're negotiating a contract. Like, hey, I'm coming out of school with $400,000 or $500,000 of student loan debt. Can you pitch me a bone? And give me a little help in terms of repaying that. And they might have to sign a 2-year contract or something like that, but maybe transition that signing bonus towards student loan repayment.
Yeah, my husband actually got his start in IHS and had a repayment program as part of that, which was great, super helpful out of school. But to that point, I was going to ask you, so $400,000 plus in debt coming out of dental school is crazy. For younger students or, maybe older students, but students fresh out of undergrad who are considering applying to dental school, but maybe are on the fence or are hesitant about it because they're facing the prospect of this astronomical debt burden, what advice would you give that student? What would you say as far as the outlook that they have in terms of being able to live a healthy and enjoyable life, I guess, facing that burden here in 4 years or so? What would you say to that student who's considering applying to dental school, but that prospect of that debt is really holding them back?
Sure. So I think there's about 75 dental schools around the country. We're actually getting a brand new one just started this year in Missouri, Joplin, Missouri. So I don't want to get in trouble because I like going and visiting schools and want to make sure I get invited back. But I mean, from a purely financial standpoint, and I don't have any numbers to back this up, so I'm just going to, full disclosure, I don't know that dentists that come from, let's just say, a very, very expensive East Coast private school comes out and makes more money than somebody that graduates from the University of Missouri, Kansas City, which is a state school.
Yeah.
Okay. So, but I can tell you that I've got clients that graduate from, East Coast private schools, dental schools that might come out of school with $500,000-$600,000 of student loan debt in 4 years, and somebody that graduates from a Midwestern dental school, in-state school, public school, come out with $250,000-$300,000 of student loan debt. So, I've got a daughter getting ready to. Our youngest goes off to college next year. Does she want to stay in, St. Louis and go to school at a community college? Heck no. Okay. but
Yeah,
financially speaking, obviously, it would be much more beneficial to us
sure.
if she did, right? So the idea of, and this is one of the things that, not to talk down to young adults, but do they really understand the impact of graduating with 300,000 as opposed to 500,000?
Yeah,
Okay, is how do they quantify the value of that additional $200,000 or $300,000 in student loan debt? Okay,
yeah.
I'm not sure that when I was 22 or 23 years old, I would have been able to make that calculation.
I
And
probably
so,
couldn't. Yeah,
and so that's where I encourage them to talk to their grandparents. Okay,
yeah, yeah.
because I don't know, again, you know, is there any study out that says somebody that graduates with 600,000 of student loan debt is going to make more over their lifetime than somebody who went to a state school? Now,
Yeah, it's an interesting question.
there's only so many seats in state schools, and so I don't completely understand that process. But if somebody doesn't get selected for a state school this year, um, can they try to get in next year? Is there something they can do for that gap year, generate some income? And so again, those are all the things. I would assume that most people, once they graduate from their undergrad, they want to go immediately into dental school. I get that. But
Yeah,
if they don't get in a state school, you know, is it
maybe wait.
worth, can they wait a year? Can they wait 2 years? I don't know what that looks like, but I do
Yeah,
know that, you look at private schools, you look at not just on the coast, but the other thing is it's expensive to live in certain parts of the country, and others it's
100%.
not as much. And, obviously people want to have a good experience and all of that stuff, but obviously I'm inclined to encourage people, if you can get into a state school and come out of dental school with 300,000, that's going to be better than 5 or
Yeah,
600. I mean,
absolutely.
it's going to take twice as long to pay off, 600,000 as it is 300,000.
Yeah, and to your point about geography and where you're living, I mean that can so impact your living expenses as well. And we know that, the loans that you can take out can account for some of those living expenses. You also mentioned, you talk about working with students maybe in their third or fourth year of dental school and the importance of getting started early. What would you advise students throughout their dental school career, though, in terms of how much money to take in terms of funding your living expenses versus your academic expenses? That's
Sure.
obviously something that I think a lot of students struggle with as well.
So I'm going to come off as old school, and I apologize for that. But there's just some things that humans have learned over time that just is it bears repeating.
Yeah, I'm
When
bracing
I
myself.
when I go to when I visit dental schools, and the parking lot is filled with much, much, much nicer cars than what I drove there.
I know what you
Okay,
mean.
uh, so um, so that's one thing. I think that, obviously as a financial advisor, I advise people, automobiles are a huge expense, and there's tremendous depreciation in the first few years. Automobiles are not good investments, right?
Right.
So I encourage folks, keep your auto expenses to a minimum, you know. Um, I also think that if there wasn't student loans, there would be virtually no reason to report on spring break. A lot of news stations wouldn't be able to report too much on what's going on spring break.
Yeah.
I think a lot of folks have, spent student loan money to go on spring break, and now that's gonna start accruing interest at
I was going to
7%.
say, what's the cost of that trip to Cancun in the long run?
Well, and if they go for 4 years, or every year they go on a trip to Cancun and it's paid for by student loans,
Yeah.
so again, old school, uh, you're going to have to pay this back.
Yeah.
There's interest accruing on it.
And it can seem easy to spend that money in the moment, right?
Oh yeah, absolutely. And then the other thing is that, you got to watch credit cards, right?
Sure.
You walk through any airport, they got the table set up, sign up, you get the free t-shirt, the free hat, whatever. And, unfortunately, a number of folks can come out of school with, 10, 15, $20,000 in
Yeah.
credit card debt. So I would just say, you got a great opportunity. You got a great career ahead of you. You're going to make a ton of money if you make good choices. You're going to be able to see the world, travel, but I would just say,
Just wait.
ask grandma and grandpa to help you set up a budget
Yeah.
while you're in school, because they've lived through ups and downs, and they understand the importance. Sometimes even parents, depending on their age, are still in that cultural. Well, anyway, I'll
Yeah.
you know what I'm saying. You know where I'm going on that.
Absolutely.
We just
Well,
got to be careful with it. Go ahead.
yeah, 100%. And yeah, I would say that that trip around the world can wait a few years. And that's definitely something that folks should keep in mind. But, you didn't come on here, I know, necessarily to talk about policy, but I'm going to put a difficult question to you as we kind of wrap up here. Can you describe in your own terms, from what you've seen over the last 30 years and certainly over the last 10 or so, working with students on student loan debt, dentists, physicians, et cetera, what is wrong with the student loan system in America and how can we fix it?
Wow. Okay. So
That's a loaded question, and we
yeah,
can have you back on another time.
yeah, no, I've obviously got an opinion on it. So the system is set up where there's no incentive for universities to keep tuition in check. And this is not just dental schools, this is higher education in general, okay?
Yeah.
There's an unlimited amount of money to go towards education. So imagine this in your business, if there was an unlimited amount of money that dentists could spend on marketing,
I can assure you that's not the case.
Right, it's not the case. But if it were the case, your fees would be higher. If there was an unlimited amount of money to pay what I do for a living, I would raise my prices. That's just the way life
Absolutely.
works, right?
That's capitalism. Yeah.
Okay, so the idea here is parents can borrow against their 401k plans for college education for their kids. Parents can take out loans. They can mortgage their house. They can take private loans out from Sallie Mae or Discover or any large bank. The federal government is going to, I have a client, fortunately only one, that has a cool $1 million in student loan debt.
Wow.
Okay, so there's an unlimited amount of money. So anytime I go visit a campus, all I see is cranes everywhere, right? Construction.
Yep.
Okay, so, and these schools are not the schools that I went to. I mean, they are the school I went to. I won't share. But anyway, the long story is, they're beautiful. You walk into these
100%.
schools now, it's like walking in the lobby of the Ritz-Carlton Hotel. Okay, now
Yeah.
I'm not saying they shouldn't be some level of comfort, but they have really transformed higher education into almost a lifestyle.
Interesting.
And so it's very, very comfortable. They kick the can down the road in terms of payment.
Yeah.
And then young adults who really don't have a sense of what $300,000, $400,000, $500,000 is, they go walk into the lobby of this school and it's just beautiful and wonderful, and that's great.
Yeah, it's kind of like spending money at Disney World.
Yeah, and so again, but there's no incentive to keep tuition in check. That would be the number one thing. And then also, now they've made some tweaks to income-driven repayment, but that's become the new SAVE plan. We didn't talk about that yet, but the new SAVE plan that just came out, basically once you've made your required payment based on your income, Uncle Sam forgives the rest of the interest. Now that's great, but that doesn't do anything to tackle principal. So the challenge is because it's so expensive now to get out of a graduate degree, they've had to stretch the payments out over 20 or 25 years. And it's really sad. And if somebody comes out of school in their late 20s or early 30s and has $400,000 or $500,000, I have clients that are putting off getting married. They're putting off starting a family. They'd like to buy a house, but if you live in Seattle, okay, or you live in New York and you're coming out of school with $400,000 or $500,000 of student loan debt and you want to buy a house and a starter is like $700,000, it's really a challenge. So, what we have to do is get back to a situation where schools are incented to keep their tuition costs pegged to inflation or something. They've been double inflation for the last 20 years. And so, and again, anytime the government gets involved, prices go up, and you can see that in healthcare, you can see that in student loans and other areas. So my encouragement is just for students going on to dental school, really think long and hard about, does it make sense can I get into a state school? Are there any scholarships? I mean, I was in the military. I got my education paid for.
Oh, that's another path. Yeah, we didn't talk about. That's a good option too.
I was in the military. I got my education paid for by the GI Bill. Yeah. So, that's a path that some folks can go into, and and that's a great way to get your education paid for. And if you're fortunate like I was, I got to live overseas for 3 years, and by the time you get done with your military commitment, your student loans are paid off. You're in a great position to buy a practice, or, I've got several clients that took that route, and that's worked out very, very well for them also.
Yeah. Yeah. Well, I appreciate you sitting on the hot seat there for a second. I know it wasn't a question you were probably anticipating this morning, but I wanted to get your take on it because you know it better than anyone, practically speaking. So as we wrap up here, I wanted just to give you an opportunity. What's the key takeaway, say, for a dental student or a new dentist fresh out of school facing $400,000, $500,000, maybe $600,000 in debt? What's the key takeaway that you want listeners to leave with today?
Sure. Well, first of all, is start planning 3 to 6 months before graduation. Don't procrastinate on this. I know there's a 6-month grace period, but 6 months of grace is 6 months of additional interest.
Absolutely.
Okay? The other thing is, I would say, you're providing a resource by having me on. There's now some other folks out there that do student loan planning. We were one of the pioneers in this, but there's others out there. Speak to somebody who actually knows what they're talking about and that has experience in this. Unfortunately, with social media and everything like that, there's a lot of bad information that's out there.
Oh, I'm sure.
People are spouting off about stuff. They're not licensed. It's not their.
You mean there's misinformation on TikTok?
There's some misinformation out there, and so I would just encourage folks to start early and make sure they get some advice from somebody who knows what they're talking about in terms of, and somebody can sit down and help them put together a comprehensive plan. Yeah. Again, student loans is not a one-time event. You're not going to pick a repayment schedule today, and then that's the payment schedule you're likely going to be on when you make your last payment. You're going to be making payments for maybe 10 years, 12 years, what have you.
Maybe more.
Having a plan in place, hopefully not more, but maybe, have a plan in place that incorporates your career aspirations, your personal family situation, and there's resources out there to help you with that.
Yeah, absolutely. And to that point, to address those resources, what can you tell us here in closing about Student Loans RX? How can folks get in touch with you if they're interested in learning more or consulting with you? Where should folks go?
Sure. So they can go to our website, studentloansrx.com, and we do offer a free 30-minute consult. We'd like to hold those until folks get into either residency or their 4th year of dental school. If they have a unique situation they want to visit with us before they get in their 4th year, that's fine. But we do offer a free 30-minute consult. And I would just say, listening to great resources like what you provide, and there's other resources out there. That's really what we encourage people to do. We are launching a new website here by the end of the year called Dental Wealth RX, which really builds on the foundation that we have on Student Loans RX for that. Okay, that person's got a plan in place now to repay student loan debt. Then what's next in their career? Is it ownership, investing, and maybe some real estate investing, et cetera. Yeah. So we're really excited to be launching that later in the year. That'll be Dental Wealth RX. We'll have that site up and running by the end of the year.
Love that. Maybe when that goes live, I can drag you back on here if you'll have it, and we can talk more about it. But Mark, I can't thank you enough for coming on today. Thank you so much for sharing your experience and insight. And I will put all that contact information, the website for Student Loans RX, in the show notes. Folks can check it out, request that free consultation if they're interested. For those of you listening today, thank you so much for stopping by again. This is the Dental Domination Podcast from Dentalscapes. We're a full-service digital marketing agency for dentists specifically. So if you're interested in that, please feel free to reach out. And if you would be so kind, if you've enjoyed what you've heard today from Mark and myself, please take a moment, give us a rating on Apple Podcasts or Spotify Podcasts or wherever you get that from. And I can't thank you enough. Thanks so much, Mark, for being here. And I hope, like I said, to drag you on again in the future if you'll have it.
It's my pleasure. Be happy to do it, Dan. Thank you.
Awesome. Thanks a lot, Mark. Take care.
Take care. Bye-bye.